Well, hello, my name is Sue Saville. Thank you for joining this discussion. Well, today we're focusing on stroke care in Europe, and particularly on the importance of advocacy and awareness. Well, two of the most influential bodies in Europe concerning stroke care are the European Stroke Organisation, known as ESO, and the Stroke Alliance for Europe, commonly known as SAFE. And these have recently joined forces to support awareness, prevention and advocacy for improved stroke research and treatments. Well, stroke patients and those looking after them need to know that they have the safety, choice and empowerment as the guiding principles of care. Well, I'd like to introduce to you now our two guests today. We have Dr. Valeria Caso, welcome, neurologist from the University of Perugia, Stroke Unit Perugia in Italy, and also the president of ESO, welcome. And also I have with me John Barrick, who is the patient advocate and president of the Board of Trustees of SAFE. Welcome to you both. So you've joined forces, collaboration. What are the overarching goals of this collaboration, Valeria?
The overarching goal is the patient. So we want to give the best treatment to the patient. So stroke patients are a very weak patient because stroke is a momentum in your life that completely change. You say the life before and after stroke. And this is something, the day you will have a stroke, the person have a stroke will never be forgotten. We had a long way to go to build up what is called the therapeutic alliance between doctors, nurses and patients, because we have to learn all together that all the components of this team are equally important, because often you have a physician talking together about patient's problems without really involving the patient in the choices. It's important because, you know, the patient are now very well educated and they want to know what we are doing. And you see when you explain and you say, okay, these are the risks, these are the benefits, they face the whole situation in a different way. And they come back to you, ask you other questions.
John, is that your view as an overarching goal, or what more would you say?
Oh, absolutely. Back in 1985, it was known that stroke units were very effective in helping people who've had a stroke. And yet, across huge swathes of Europe, stroke units are only really being introduced in the last 10 years. And one has to say that one of the reasons for that is that there wasn't active patient organisations working with those professionals who could put these units into place, working to influence politicians and health system decision makers to get those stroke units up and running. This memorandum of understanding that we've signed is really a real shout now to say we've got to make progress in stroke care, and it's not just acute care.
Now, you mentioned the memorandum. It all sounds very formal. Do you have any formal targets, any aspirations, any goals you've set in this memorandum?
Well, yes. I mean, one of those is exactly what Valeria's been saying, which is that we actually communicate with each other. We're sticks separately, but joined together, we're stronger. So can we actually have a dialogue which helps us to understand what each other are wanting to achieve? And then if we can support each other, we're more likely to get there. Surely we can begin to plug the gaps in the many countries that don't have proper care systems in place.
So a lot has been done, perhaps. Valeria, what about the things that have been done? The commissioning of the burden of stroke, the report on this, there are more meetings in the EU now, a commitment to have a meeting every year, every May.
Yes.
What has been achieved? How is the push going forward?
I think we are doing, from terms of treatment, we have now evidence treatment for acute care of stroke. We have thrombectomy, which improves the outcome of the patients tremendously. We have preventive therapy for patients with atrial fibrillation, where we can really reduce the risk of having a stroke. There's so many things really going on, and we have spoken together with John. We were to the European Commission.
So there's a great deal that we could cover here, but I'd like to ask you both, perhaps in summary, to think about the points that you'd like to see in terms of what more could be done, in terms of research, in terms of awareness, advocacy. John, what would you like to see done?
Well, there's a huge amount that needs to be done, but if I could just mention, a lot could be done if the resources are allocated to it. The Burden of Stroke report, which we've commissioned, will show that the number of people who are expected to have strokes is going to rise dramatically in Europe over the next 30 years. And, you know, if we can get people to understand how profound these problems are going to be, then we hope that there'll be that extra incentive to put resources into both some research that can deal with these things and the resources into making sure that we avert the economic and family catastrophes that will come from stroke.
Thank you. And Valeria, your final thoughts on what needs to be done for research, for awareness, for advocacy?
When they recognize there needs to be a pathway, an immediate pathway to the hospital, then we have to have every patient, there's a Bill of Rights for patient, needs to go to a stroke unit where they can have thrombolysis treatment, thrombectomy treatment, then early secondary prevention treatment, early management of complication. But I think there is a lot of things going on, so I'm quite sure that if politician understands that we can defeat stroke, we can stop stroke, we can do a lot.
Thank you. And with that collaboration, you're moving forward. Thank you both very, very much for your contributions there. And with that, we'll leave it there. Thank you for joining this discussion.